Bismillahirrahmanirrahim. Hello and welcome back. In this video, we'll discuss the different differential diagnosis of tachyarrhythmias. As we said in the code of heart rate, tachycardia means heart rate above 100 beat per minute. Let's first see this demonstration. As you know, tachycardia or tachyarrhythmia may be a narrow complex or wide complex, and it may be regular and irregular. For simplification, we will discuss it in a simplified manner. So let's go to our whiteboard. As you know, this is the SA node, and this is internodal fibers coming to the AV nodes in his bundle and right bundle, left bundle branch blocks. So let's think, how can tachycardia occurs or tachyarrhythmia occur? First of all, as you know, this is the SA node, which is under control of two autonomic systems, the sympathetic nervous system, CNS, which stimulates the SA node causing tachycardia. And also there is parasympathetic nervous system, BNS, which inhibits the SA node causing sinus bradycardia, causing it to discharge in a slow pattern, causing sinus bradycardia. So the first form of tachycardia is sinus tachycardia, in which SA node is the primary pacemaker and electricity distributes through the normal conductive pathway, but its rate is above 100 beats per minute. So the first form of tachycardia is sinus tachycardia, and if you think it, there will be a B wave followed by narrow QRS, B followed by narrow QRS, but in a rapid rate which is above 100 beats per minute. This is sinus tachycardia. Occurs in any situation which stimulates the SA node, increasing its rate of firing, like sympathetic overstimulation, causing it to produce a sinus rhythm, but in a tachycardic manner. Okay. The second form of tachycardia that may occur is that the atria developed multiple foci. Instead of the SA node, there will be 3 or more separate foci act as pacemakers of the heart. At each cycle, every focus will stimulate the atrium in a different from certain part, so producing a certain shape of B wave. So if this node fires, it will stimulate the atria, producing a B wave like this. Then contraction reach AV node and reaches the ventricles, so produce a QRS. Then this focus stimulates the atria from another part, so the shape of B wave will be different shape like this. Then electricity reach AV node and ventricle, producing the narrow QRS complex. Then the third wave, the third focus, will stimulate the atria from this position, producing a third shape of a B wave like this. Like this, followed by QRS complex. And the fourth wave will stimulate the atria from a different position, producing another form of B wave like this, followed by QRS complex. So you will see a multiple different shapes of B wave. This is a shape, this is another shape, this is another shape, and this is another shape. So if you see 3 or more shapes of B wave, this means that there are multiple primary focuses in the atria, and this tachycardia called MAT, multifocal atrial tachycardia. Multifocal, as there are multiple foci. Atrial, these foci are in the atria. Tachycardia, the heart rate is above 100 beats per minute. And this form of arrhythmia, multifocal atrial tachycardia, is common in COPD patients, chronic chest patients, and the patients taking bronchodilators. Okay, so let's think again. Tachycardia maybe a sinus tachycardia. SA node is the primary pacemaker, but it fires rapidly, producing a heart rate above 100 beats per minute. It may be due to multiple foci in the atrium, discharging from different ways, producing multiple shapes of B waves. Presence of 3 or more B wave morphologies is called multifocal atrial tachycardia. Okay. Another form of pathology is that there are multiple foci, but a re-entry circuit occurs between them. So these two foci form a re-entry. This focus stimulates the other focus, and this focus re-stimulates the another focus, producing electricity that conducts through the AV node to the ventricles. And these two foci form a re-entry circuit between them and stimulate the atrium. And these two foci re-stimulate each other, stimulating the atrium and reach the ventricles through the AV node. This form of re-entry is called atrial flutter, in which the atrium is stimulated by multiple re-entry circuits, producing a multiple B waves at the same time. So you'll see a B wave and B wave and B wave, then QRS complex, then B wave, B wave, B wave, B wave, then QRS complex, and B wave, then QRS complex, etc. These multiple B's produce a pattern of sawtooth appearance, like the shape of the sawtooth. So this form of arrhythmia or tachyarrhythmia called the atrial flutter. Atrial flutter. So atrial flutter means that there are a multiple foci. These multiple foci develop multiple re-entry circuits between each other and stimulate the atria multiple times, producing multiple repetitive beats in the form of a sawtooth pattern or sawtooth appearance. Every 3 or 4 beats will be one will be conducted to the ventricle, producing contraction. This conduction, this AV nodal conduction, may be fixed. I mean that from each 2 beats of atrial contraction, it conduct 1. So this is called 2 to 1. So you'll see a 1B and another B, then QRS. You will see a B and another B, then QRS. This is called 2 to 1 conduction of the atrial flutter, or maybe 3 to 1. You will see 1B and another B and another B, then QRS complex. Then you'll see a 1B, another B, and third B, then QRS complex. This is a fixed conduction, maybe 2 to 1 and maybe 3 to 1. And here the flutter is regular because the conduction is fixed. But maybe variable conduction, like the previous example. Here 3 B's are conducted, here 4 B's are conducted, here 2 B's are conducted. So you'll see the sawtooth appearance and irregular QRS complex intervals. So atrial flutter may be irregular due to variable conduction, or may be regular due to fixed conduction, which may be 2 to 1 or 3 to 1. So tachycardias may be due to stimulation of the SA node, causing sinus tachycardia, may be due to presence of a multiple foci in the atria. Each one act in a separate cycle, producing multiple shapes of B waves, causing multifocal atrial tachycardia. Maybe these multiple foci develop re-entry circuits between each other, stimulating repetitively the atrium, producing the sawtooth appearance. And this multiple atrial activities can be conducted with a fixed ratio through the through AV node, producing a 2 to 1 or 3 to 1 regular atrial flutter, or may be conducted variably, producing an irregular sawtooth pattern of atrial flutter. And the next pattern of arrhythmia, that the atria develops hundreds of foci. These foci stimulate the atria at the same time. So the atrium become unable to contract, it just fibrillate and unable to produce an actual contraction. It's just fibrillating, not causing an effective atrial contraction. So here there is no P wave, as there is no atrial contraction. It's just fibrillatory waves, small fibrillatory waves. So this pattern called atrial fibrillation, or what we call AF. Atrial fibrillation due to presence of hundreds of electrical foci in the atrium, make it the atrium to fibrillate and unable to contract. So you will see absence of B wave, just presence of fibrillatory waves and variable conduction of QRS complex between each fibrillatory waves. So atrial fibrillation is characterized by absence of B wave, no B waves, and irregular intervals between each QRS complex. This is called the atrial fibrillation. And in this form of arrhythmia, the atrium cannot contract, just fibrillating. And this inability to contract makes the atria cause stagnation of blood not moving well in the atria, and this causes the atrium to be liable to form thrombi inside it, form thrombus due to stagnation of the blood, and this thrombus can shower and cause embolic manifestations like stroke, like peripheral artery disease, or peripheral artery occlusion, or mesenteric vascular occlusion, etc. And the final form of tachyarrhythmia at the level of the atrium is that this AV node, if we can remove this, the AV node, this AV node can develop a re-entry circuit. This AV node, if you look at this, can develop a re-entry circuit. Anatomically, AV node is formed of two parts, one part called slow pathway and the other part called a fast pathway. We will not go in depth in these details, but to enable to be to understand, we will just show this. Normally, the conduction goes through the fast pathway from of the AV node. From this is the fast, and this is the slow pathway. Normally, conduction goes through the fast pathway to reach the ventricle and induce contraction. In some pathologies, this slow pathway will function and work. So the electricity goes through the slow pathway and re-enter the fast pathway, then goes through the slow pathway and re-enter the fast pathway. This activity will go up to stimulate the atria and go down at the same time to stimulate the ventricle. So atrium and the ventricle will contract at the same time. Atrial contraction produce a B wave, and the ventricular contraction produce a QRS. The voltage of the QRS is larger than the voltage of the B wave, so it will mask it. So in atria, this form of arrhythmia called SVT, supraventricular tachycardia, in which you will not see a B wave. There is absence of B wave. You will just see a QRS complex, and it will be narrow because this re-entry circuit is regular. So you'll see a narrow QRS complexes, tachycardic with absence of B waves. So to differentiate between SVT and the atrial fibrillation, both of which there is an absence of the T wave, of the B wave, sorry, but in the atrial fibrillation, QRS ratios is irregular, but in SVT, QRS is regular. Okay, so the different patterns of tachycardias at the atrial level, count with me. The first thing is sinus tachycardia due to stimulation of increased firing of the SA node. The second form is presence of multiple ectopic foci producing a multifocal atrial tachycardia. The third form is development of re-entry circuits between these multiple foci, causing repetitive activation of the atrium, producing a sawtooth pattern of B waves. This is called the atrial flutter. And this flutter activity can be conducted with a fixed ratio through AV node, causing 2:1 or 3:1 regular atrial flutter, or may be conducted variably through AV node, producing a variable irregular atrial flutter. Then the atrium can develop hundreds of ectopic foci, causing the atrium to just fibrillate, not contracting, producing atrial fibrillation. And finally, AV node can develop a re-entry circuit, producing supraventricular tachycardias, which is the fifth form of tachycardia at the atrial level. If you see, all atrial tachycardias has a narrow QRS as a general rule we mentioned before. Any tachycardia or any electricity arising from atrial level, from AV node to above, is narrow QRS. Ventricle, this tachycardia will be a wide QRS complex, as we will discuss in the next slide. So let's apply and see ECG of these patterns. Let's go to our presentation. Yes, in this result, you will see a B wave followed by QRS complex narrow, then B followed by QRS, then B followed by QRS. So it is a sinus rhythm. But here, the large squares between each QRS complex about 2. So here the heart rate is about above 100. So it is tachycardic. So this form of tachycardia is sinus tachycardia. If you look at this form, here you'll see multiple shapes of B. This is a shape of the B wave. This is another shape. This is a third shape. So this is a fourth shape, which is biphasic, some positive and some negative. So here you see multiple shapes of B waves. So it is a multifocal atrial tachycardia. Here, yes, you see this is a 1B followed by QRS. This is a 1B followed by QRS. Here you see a 3Bs, which produces a sawtooth appearance of B waves followed by QRS. So this is an atrial flutter with variable AV conduction. So it is an irregular atrial flutter. But here, if you look at V1 lead, this is a 1B, 2B, 3Bs followed by QRS. Then 1, 2, 3 followed by QRS. Then 1, 2, 3 followed by QRS. So this is an atrial flutter with a fixed 3 to 1 AV conduction. With fixed 3 to 1 AV conduction. In this rhythm, here you see a fibrillatory waves. This shape is called fibrillatory waves, not actual B waves, with irregular QRS intervals. So this ECG is atrial fibrillation. And finally, here you cannot see any B waves, but you can see a narrow QRS complex with regular intervals. So this is SVT, supraventricular tachycardia, due to re-entry circuits at level of AV node. So here we have discussed the narrow tachycardias, which are arising from the atrial level, the sinus tachycardia. The second one is multifocal atrial tachycardia. The third one is atrial flutter, either with variable AV conduction or with fixed AV conduction. The fourth one is atrial fibrillation. And the last one is supraventricular tachycardias. I know that this part is a tough one. I hope I have made it more simplified. If there are any questions, please put them in the discussion forum. And in the next video, we'll discuss the tachycardia or tachyarrhythmias that arise at the ventricular level. Thank you very much and see you in the next video.